Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, we're so glad you're joining us today. We've got a full lineup covering everything from airborne infection risk to some really inspiring dementia care strategies.
Right. And it all connects to the work being done every day in senior living communities. We're starting with a global view from the World Health Organization on airborne transmission, then zooming into practical infection prevention guidelines that are tailor-made for assisted living.
We'll also talk about tracking infections with the CDC's NHSN forms and some smart planning tools like the DASH tool for disaster supply estimates.
And speaking of preparedness, we've got some great tips from PharMerica on making sure medication management doesn't miss a beat during emergencies.
Then we're wrapping up with an uplifting story out of Kemper House, a community that's taking a fresh approach to dementia care that's actually slowing progression for residents.
So whether you're in operations, nursing, or just passionate about senior living, there's something in here for you.
Let's get into it. So to kick things off, let's talk about this new report from the World Health Organization.
Yeah, the one on indoor airborne risk assessment in the context of SARS-CoV-2.
That's the one. It's basically a guide for understanding how the virus spreads through the air in indoor environments, like, say, senior living communities.
Which is huge, right? Because even though we're not in the height of the pandemic anymore, airborne transmission is still a concern, especially with vulnerable populations.
Right. And what's great about this report is that it doesn't just explain the science, it actually gives you a model to assess the level of risk in a space based on things like ventilation, occupancy, and exposure time.
It kind of reminds me of that Swiss cheese model for infection control. Every layer matters. And this one is all about reducing the chance that airborne particles can build up and spread.
Totally. So the takeaway here is, it's not just about masks or distancing, it's about airflow, filtration, how long people are in a room, and how many people are there in the first place.
And that applies directly to senior living. Think about dining areas, common rooms, even group activities. This gives leadership teams a way to look at those spaces and say, okay, how can we lower the risk here?
Plus, if you're planning any sort of renovation or HVAC upgrade, this kind of data is gold.
For sure. And it's also about being proactive, building these strategies into your community's ongoing risk assessment plans, not just responding when something flares up.
So yeah, big picture. This WHO report gives us a framework to be smarter and more strategic about the air we all share, because that's part of caring for the resident too.
All right, building on that, let's get into the new infection prevention and control guidelines from Argentum and the Quality and Assisted Living Collaborative.
Yeah, this is a big deal because for a long time, assisted living communities didn't have tailored infection control guidance like this.
That's right. Most of what was out there was geared toward hospitals or skilled nursing, and it just didn't fit the assisted living model.
These new guidelines fill that gap. They're flexible, scalable, and really focused on helping communities build an infection prevention plan that works for their specific size and setup.
And one of the key things they recommend? Designating an infection prevention and control lead. Someone in the community who takes ownership of infection prevention, not just during an outbreak, but as part of everyday operations.
They also cover practical stuff like staff training, visitor policies, environmental cleaning, and even how to structure your response when there is a suspected case.
What I like is that it's not one size fits all. If you're in a small boutique community or a larger campus with multiple buildings, you can still apply these principles in a way that makes sense.
Yeah, and they really emphasize that this isn't just about compliance, it's about building a culture of prevention.
And that culture benefits everyone. Residents feel better cared for, families have more peace of mind, and staff are more confident in what to do when something comes up.
So if you haven't looked at the guidelines yet, it's worth diving in. Even if you already have policies in place, this is a great time to update them and make sure they reflect what we've learned over the past few years.
Because at the end of the day, prevention isn't just about stopping illness. It's about protecting the dignity and quality of life for the people we serve.
So, building on that, let's talk about how we track the impact of all these infection prevention efforts, specifically through the CDC's Lab ID event form.
Yeah, this is Form 57.138 if you want to get technical. It's part of the National Healthcare Safety Network, or NHSN. and it's designed just for long-term care communities.
And it plays a big role in helping communities monitor things like Clostridioides difficile and multi-drug resistant organisms, things that can spread quickly if they're not caught early.
Exactly. The form allows you to report lab-identified events in a standardized way, which means the data can be compared across communities and used to track national trends.
And on the community level, it helps you see your own infection patterns over time. Are rates going up? Are interventions working? It gives you that visibility.
Plus, let's be honest, there's a compliance angle here too. Reporting through NHSN is becoming more and more important for quality measures and CMS programs.
Right, and even if your state doesn't require it yet, having these systems in place now puts you ahead of the curve.
And it's not just about collecting data, it's about what you do with it. That info should feed right back into your infection prevention and control planning.
It's one thing to have policies, but when you can back those up with real-time data, that's when you start to see meaningful change.
So if your team isn't already familiar with this form, now's a great time to introduce it. It's simple, it's structured, and it makes your infection data work harder for you.
Next up, let's talk about disaster planning, specifically the DASH tool from ASPR Tracy.
Yeah, DASH stands for Disaster Available Supplies in Hospitals, but it's absolutely useful for senior living communities too.
What's cool about this tool is that it helps you estimate how many supplies like PPE, medications, and oxygen you'd need in different emergency scenarios.
It's customizable too. You enter your community size, acuity levels, and the type of event you're planning for, and it gives you a breakdown of the supplies you should have on hand.
That's super helpful, especially when you're trying to plan for wildfires, hurricanes, or even extended power outages.
And honestly, this kind of planning used to be more reactive. Now, with tools like DASH, communities can be much more strategic and ready before the pressure hits.
One of the things I appreciate is how it supports continuity of care. It's not just about having stuff. It's about making sure residents continue to receive the support they need during a crisis.
Plus, it's a great conversation starter between administrators, nursing, and emergency management teams. Everyone's on the same page about what's needed and why.
So if disaster prep has felt overwhelming in the past, this tool makes it feel a lot more manageable. It's structured, practical, and based on real-world healthcare data.
If you haven't checked it out yet, this is a great time to pull it up and walk through a few scenarios with your leadership team. You might be surprised what gaps it helps you uncover.
So following that, let's talk about another key part of disaster readiness, making sure residents continue to get their medications no matter what.
Yeah, PharMerica put out a really helpful guide that walks through how senior living communities can prepare for emergencies from a pharmacy standpoint.
What stands out is how detailed it is. We're talking everything from maintaining a 5 to 14-day supply of critical meds to printing out paper MARs in case your system goes down.
They also recommend creating go packs for residents in case of evacuation, complete with meds, dosing instructions, and any special considerations.
It's the kind of preparation that doesn't always get as much attention, but it can absolutely make or break how smoothly a community weathers a disaster.
The residents are obviously the priority, but the guide also focuses on equipping staff with the tools and information they need to keep things running, even when the power's out or the phones aren't working.
The guide also talks about partnering closely with your pharmacy provider, making sure those lines of communication are open and strong before a crisis hits.
That kind of relationship makes a big difference. When a disaster hits, you don't want to be scrambling. You want to know who to call, what they can do for you, and how fast they can move.
If you're already using the DASH tool, this guide is the next step. It takes the broader supply conversation and drills down into one of the most essential areas of care.
So even if you feel confident in your emergency plan, this is a great resource to double-check your medication protocols and make sure no detail gets overlooked.
Before we jump into our last story, this is a great time to remind everyone that HealthCap has its own emergency preparedness toolkit, available through our Resource and Education Center.
If those last two stories about disaster supply planning and medication readiness got you thinking about your own community's plans, this toolkit is the perfect next step.
It's filled with senior living-specific checklists, templates, and planning guides to help you strengthen your emergency protocols without starting from scratch.
You can access it anytime at riskmanagement.healthcapusa.com.
All right, let's wrap things up with a story that really shows the heart of what we do. This one comes from Provider Magazine, and it highlights some incredible work happening at Kemper House, a residential community specializing in dementia care.
Yeah, what they're doing is pretty inspiring. Instead of focusing only on managing symptoms, they're looking at how to actually slow the progression of dementia.
They've adopted a functional medicine approach, so things like personalized nutrition, physical activity, social engagement, and brain-stimulating activities are all built into the daily routine.
And it's working. Residents are showing improved engagement, better mood, and even reductions in medications, especially psychotropics.
What stood out to me was how much they involve families to help loved ones understand the same routines and philosophies being used in the community.
That connection between clinical care and lifestyle is so powerful. It's not about a cure, it's about quality of life and helping residents live with purpose and dignity.
This model also gives staff more meaningful ways to interact with residents. They're not just managing behaviors, they're supporting wellness.
And it's a reminder that innovation in senior living isn't just about new tech. It's about reimagining how we care for people through compassion, intention, and creativity.
So whether you're in memory care or just looking to bring more engagement into your community, Kemper House is a great example of what's possible when we shift our perspective.
That brings us to the end of this week's HealthCap Weekly Wrap.
Thanks for joining us as we covered everything from infection prevention and emergency planning to the power of innovative dementia care.
These stories really highlight how every part of the work we do, whether it's preparing for the unexpected or rethinking daily routines, ultimately comes back to caring for the resident.
And don't forget, if you want more details on any of the stories we talked about today, you can find them in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
We'll be back next week with more insights, resources, and stories from the world of senior living.
Until then, take care, and thanks for all you do.